Hello, my name is Dr. Rita Gengo, and I am an assistant professor at Florida Atlantic University, Christine Eileen College of Nursing. February is American Heart Month, a time dedicated to raising awareness about cardiovascular health, empowering individuals to take proactive steps towards a healthier heart, and encouraging everyone to focus on their cardiovascular health. I am honored to celebrate this month with Mended Hearts and all of you. In this video, I will answer some questions sent by patients to Mended Hearts. The first question is, what is heart failure? The heart is a vital muscle that beats around 60 to 100 times per minute to pump blood throughout the body. The blood carries oxygen and nutrients to all organs, enabling them to function properly. Heart failure is a serious, chronic, lifelong condition that affects more than 6 million Americans. It happens when the heart is weak and unable to pump enough blood to meet the body's needs. It is important to note that heart failure does not mean that the heart has stopped working, but rather that the heart is unable to pump blood as effectively as it should. Heart failure can be caused by various factors, such as damage to the heart muscle or to the heart valves. These changes can weaken the heart's ability to contract, which prevents the heart from effectively pushing blood into the circulation. Alternatively, the heart muscle may become stiff, causing it to lose its ability to relax and hold blood returning from the body. It is possible for heart failure to affect either the left side of the heart, the right side of the heart, or both sides. Most commonly, the left side is affected and the right side is affected as a consequence of the left side heart failure. Our next question is, how can I prevent heart failure? Heart failure often develops in people who have or had another heart condition or another disease that affects the heart. These conditions are known as risk factors, and they can increase the likelihood of heart failure. The main risk factors are coronary artery disease or heart attack or MI, myocardial infarction, high blood pressure, also known as hypertension, diabetes, metabolic syndrome, which happens when you have three or more of the following: large waistline, high fasting triglycerides, low levels of the good cholesterol in your blood, high blood pressure, and high fasting blood sugar. Another risk factor is hyperactive thyroid problems, meaning that when the thyroid is working more than it should, or hyperthyroidism, abnormal heart rhythm, anemia, smoking, being obese or overweight, alcohol or drug abuse, and infections by some viruses such as the coronavirus or HIV. To prevent heart failure, we need to control these risk factors by taking the medications as your provider recommended, following your provider's recommendation for immunization, and adopting a healthy lifestyle. Our next questions are, how do I know if I have heart failure, and what are the symptoms of heart failure? The short answer to these questions is, you may suspect you have heart failure by knowing and monitoring your body for signs and symptoms of heart failure. If you have one or more symptoms of heart failure, tell your provider and ask them for a cardiac evaluation. In the next few minutes, I want to talk with you about the most common signs and symptoms of heart failure. The first one, shortness of breath. People with heart failure find themselves out of breath more than usual while doing some common activities, such as walking or going up and down the stairs. Some people even get shortness of breath when they are resting, or they might find it difficult to lie down flat. Some people find themselves waking up in the middle of the night, coughing, or with extreme difficulty breathing. If you have difficulties lying down, you can try to use some extra pillows that will put you up a little bit, and this will make it easier to breathe. If you wake up breathless, sit yourself up as much as you can. Try to keep calm. Take deep breaths. Some people find that sitting in front of an open window also helps with their breathing. So these are some strategies that you can try if you have some of these symptoms. The other symptom that I want to mention is swelling of the feet, legs, ankles, or abdomen. This happens because of the extra water that builds up in your body when the kidneys cannot do their work of eliminating this extra water because the heart is not pumping enough blood through the kidneys. A buildup of water in the body will cause swelling of all these body parts and also will cause you to gain weight. Speaking of gaining weight, sudden weight gain is another sign of heart failure. This is an important sign that your body is holding up fluid and may be the first sign that a person with heart failure will notice when their heart condition is worsening. Sudden weight gain means putting on an extra 2 to 3 pounds in a 24-hour period or more than 5 pounds in a week. So monitoring your weight daily is the best way to monitor if your body is holding up excess fluid. Weigh yourself first thing in the morning and keep track of your weight in a diary. If you have heart failure, always ask your provider about how much fluid you can have per day and follow those instructions closely. You will also need to reduce the amount of salt that you consume daily. Ask your provider how much salt you can use on an everyday basis and what alternatives you can use to season your food. By controlling the amount of fluid and salt that you have every day, you are helping your body and your heart to work at the best of its capabilities and preventing the buildup of fluid in your body. Other symptoms of heart failure also include increased heart rate, that you may feel like the heart is racing or throbbing, or heart palpitations. Another symptom is confusion or impaired thinking, lack of appetite, nausea, or what we say like an upset stomach. There is another important symptom of heart failure, which is feeling unusually tired or weak. This is also known as fatigue. Fatigue is mentioned by patients with heart failure as one of the most distressing and debilitating symptoms. It's very common in patients with heart failure. And if you have fatigue, you are likely to feel tired all the time, or you don't feel rested when you wake up in the morning, or you may have difficulties doing your everyday activities. You just feel that you don't have energy to go shopping, cook, walk. So it's very important that you are able to recognize if you have fatigue. However, it is very challenging, especially for healthcare providers, to diagnose fatigue, mainly because of two reasons. One is that patients do not tell their providers that they are feeling unusually tired because they think that it's just part of their disease process and that they need to live with it. And the second reason is that providers do not have a tool like a blood pressure monitor or a thermometer that they can use to measure fatigue. Providers depend on the patient's report, and also they can use some surveys to diagnose fatigue. The problem with surveys is that the surveys we have available to assess fatigue in patients with heart failure have some limitations. As a nurse and a researcher interested in helping patients with heart failure, I am conducting a research to investigate whether the Modified Impact Fatigue Scale is a survey that providers can use to help patients with heart failure. In this research, participants are asked to respond to 5 short online surveys, and at the end, they will receive a gift card. If you are 18 years or older, have been diagnosed with heart failure, if you are not hospitalized, so if you're out of the hospital, if you are able to read and understand English, and if you have access to a computer or tablet with internet connection, you might be eligible to participate in this study. So if you are interested, please contact me by email or phone. Our next question is, how do you treat heart failure? Heart failure is treated using a combination of strategies. These strategies will include medications, lifestyle changes, and it also may include the use of some devices and surgical procedures. Lifestyle changes help you control heart failure symptoms, slow down the disease progression, and improve your quality of life and well-being. Even small changes in lifestyle make a huge impact on your overall and heart health. These lifestyle changes include healthy diet and being physically active. In addition, monitoring your weight daily, quitting smoking, scheduling time every day to relax and rest, getting a good night of sleep, managing stress, tracking your daily fluid intake, avoiding or limiting alcoholic beverages, keeping your blood pressure controlled, getting vaccinated against the flu, pneumonia, and staying safe from COVID. Concerning medications, your provider will likely use a combination of medications. The most common medications used to treat heart failure include those that lower your blood pressure to reduce the workload of your heart, for example, lisinopril or losartan. Medications that improve blood flow throughout the body, reduce sodium retention, and decrease the strain on your heart, like Entresto. Medications that reduce the heart rate, such as carvedilol. Medications that improve blood glucose and decrease body weight and blood pressure, such as Jardiance or Farxiga. And also water pills that will help your body get rid of the excess fluid and sodium. One example of these water pills is furosemide. Some people might need some devices, such as an implantable cardioverter defibrillator, also known as ICD. This device is surgically implanted to detect life-threatening arrhythmias and deliver a shock to reset the heart rhythm to when a life-threatening arrhythmia is detected. Another device is a biventricular pacing to help the lower cardiac chambers to pump at the same time. When the disease is too severe and the heart is no longer responding to these therapies, a surgical procedure called heart transplantation can be done. In this procedure, the surgeon removes the damaged heart and replaces it with a healthy heart from a donor. Our last question is, can I still live a normal life with heart failure? When people are diagnosed with heart failure, they often feel shocked and lost. And this is completely normal because the diagnosis comes with a lot of new information, a lot of changes. However, by learning about their condition and changing habits, people with heart failure can manage their symptoms and experience a good quality of life and well-being. Most people can continue working as long as they are stable and feel well enough. Traveling may also be possible. Just make sure to discuss your plans with your provider, as they may advise some changes to your medications, and they need to clear you up for traveling by plane, for example. So, adopting a healthy lifestyle, tracking symptoms, and follow up care are all essential pieces of living the best life you can after being diagnosed with heart failure. Feeling afraid, scared, sometimes angry, feeling alone, or feeling just different from the person you used to be before being diagnosed with heart failure is common. It is important that you recognize your emotions and ask for help if you need. Lastly, staying connected with family, friends, or other peers with a similar condition is also important to maintain your emotional and social health. Remember that family and friends might be scared as well, and they sometimes can be annoying, or they might say or do things that sound insensitive, but most likely they are trying just to be helpful. They are not trying to hurt you. To wrap up, I want to share with you that there are several resources to help you manage heart failure and live life healthier and happier. You can find some of these resources on the American Heart Association website. This is the website, and you can scan this QR code to be directed to the American Heart Association website. Um, thank you so much for your questions and for your attention, and I hope to see you next time. Thank you.